Good evening, Assalamu alaikum, and a very warm welcome to Visionary Pulse with me, your host Farzana Mayet, a segment which focuses on chatting to visionary game changers and change makers. And tonight is certainly no different, as we're going to be chatting to one such inspirational visionary game changer and change maker. We say a very good evening and a warm welcome to Professor Carol Ann Benn, who is an extraordinary professor with the Department of Immunology at the University of Pretoria and a fellow of the College of Surgeons of South Africa. She is an outstanding oncology expert with a special interest in breast disease, with over 20 years of experience as the head of breast units in both public and private sectors. She is dedicated to providing healthcare access to all who require it. She has contributed significantly to the medical community through her published and presented work and is recognized internationally as well as a leader in breast disease. Professor Benn established the Breast Health Foundation, various breast health care forums and outreach programs, and the Netcare Breast Care Center of Excellence, which is the only internationally accredited unit in South Africa with NABPC accreditation. Along with her positions of responsibility, she manages continuing research, and her numerous awards testify to her esteemed position in the medical field and South African society. Professor Benn, good evening, and thank you so much for joining me on Visionary Pulse. It is such an honor and a privilege having you on my show.
Absolute pleasure.
So, Professor, you have juggled so many hats thus far. It is such an inspiring feat to have you on my show this evening. So, please tell me, you have a vast profile, and this show focuses on visionary game changers and change makers. Not all is mentioned in your profile. Definitely, I have been sent the real summarized version of your vast profile. So, please tell our viewers who is Professor Carol Benn.
So I think that I grew up in a family where my mom, we mentioned earlier, she was involved in freedom fighting, and I grew up with this concept. I come from a family of teachers, okay?
Oh, yeah, wow, okay.
So no one in medicine in my family. I had an aunt who was in nursing, and I always wanted to do my bit to help out. I wasn't particularly good at maths, and everyone thought I'd go into journalism.
Okay.
So I really wanted to do medicine. So I worked really hard at school, and I got in, and I waitressed 4 nights a week to put myself through medical school. So I understand the concept of hard work. I also understand
from a fairly young age.
Absolutely. I also understand the concept of if you have a dream, you write it down and you focus and you go out there and really push hard to do it. Once I'd finished medical school, I did my internship at Chris Barrow. I was a non-rotating registrar. My partner was a wonderful black doctor, and obviously we weren't allowed in white hospitals. And I was already publishing at that stage, and the professor of surgery saw all my writing, and he called me into his office, and he was like, I knew. And I then landed up doing a year of vascular, and we didn't see cancer in the community in which I was working, in the black communities. And I thought, this is absolutely can't be. So I actually found one of my early patients over over 30 years ago. In fact, she died recently, about a month or 2 ago, not from cancer, from old age, Gogo. And after I treated her, we went out into the townships and we started speaking to people. And the more we did that, we realized, okay, how much cancer was out there. Then I realized that the guy who trained me, he said, can I come help out? He fell down the stairs at the J, how badly women were being treated. So I found, like, guys sitting there reading their newspaper, oh, you got cancer, take your breast off, and I thought, this is worse than the trauma I'm dealing with at Barra. And so I found funding, and I went and I got gaps of training with probably the top 2 people in breast cancer in the world, a guy by the name of Umberto Veronese and Bernie Fisher, who were doing breast saving and all sorts of amazing work. And I met a lady called Nancy Brinker, who ran the Komen Foundation. Her sister died of cancer, and I thought, you know what? this is what I need to bring back home. And I must say it was an uphill battle. So the first Congress I spoke at, the Stanton Convention Center, I had these male surgeons just booing me off the stage. No, women shouldn't be having breast saving, shouldn't be, they need to live for a year. And I was thinking, but this is not how we treat people. And Professor Veronese was there, and he said, you keep on doing what you're doing. And I started to realize that if we're battling to change the mindset of medical fraternity, we need to go out there and empower people to realize their bodies, not the doctors, ask questions, put the patient in the center. What are we doing? It's the person who's going through a cancer. So I understand the concept of, I think another important thing for me is that if something's not working in one direction, go at it from another direction.
Okay.
But if you're going to push for what's right, you must keep on pushing until the voice is heard of the people who need to be heard. So I set up multidisciplinary units. I got awards from Discovery. Now it's a regular. And then I thought this is not good enough, because it's one thing having everyone saying we're meeting together as a team.
Yes.
But who's verifying that I'm not your best buddy and you're not the best buddy?
How is that vetted? Yes.
Exactly, exactly. So then I thought, we've been doing this for over 10 years. I then looked at which is the highest accreditation you can get in the world. Okay.
Wow, okay.
Around centers, because you always set your bar highest. And
right.
I did the same thing at my Helen Joseph unit. So I put $500,000 into there because I'm passionate about looking after people, irrespective of whether they have access to funding or not. I'm not anti-concepts of national health and everything. We need to look after people. We need to make sure, and we need to work out ways to make sure that whether you are, and I always talk about the cancer journey as if you're catching a plane, whether you're sitting in the first business class seat or the back row in economy, you need a safe takeoff, safe landing, safe journey. You may not need all the bells and whistles, but we have a right to make sure that we're looking after people properly. So, so then I set up accreditation, and in fact we got top 3 in accredited units in the world, and that is really important. So what we want, and I have an access system, so whether people don't have access to funding or do have access to
right.
funding, they need to be looked after.
But I love that, Professor, and love the passion
help.
And the dedication that you've poured into this.
Yeah, you've got to do it. And then part of making sure that you're successful is to realize what you're not good at, your strengths and weaknesses. And I'm grateful for an amazing family, okay? And I'm grateful for an amazing work team, because they play into all my weaknesses and help me with my strengths. So setting up things means playing together and learning all the time. One of my young oncoplastic team said to me on Saturday when we were operating, before I went across to the award ceremony, she said we should all get together and work out of their aspect of the team, who's good at what and how we can help out. And I said that, what a good idea. We should actually just have a cup of coffee once or twice a year, because we do have leadership meetings and everything, but within each team, so sub-team, work out who's good at this, who should be doing this, and that's what we want. So the reason why I have loads of publications, because I realize you bring everybody up by working together. So I'm fully approachable from any aspect.
Absolutely.
Okay, because that's what you need with your team. And I love it when people come to me with ideas. Love it. You know what? Have you thought of it doing this way? That could be better than doing it that way.
But that's so brilliant, and I think that comes from a place of you having experienced the no's before.
Yes.
You know, the constant no's by your peers, that no, it cannot work.
Absolutely.
So it's made you more susceptible to say, look, I'm all here for change. I'm all here for different ideologies.
Absolutely. And it's also important to forgive.
Right.
So I have had some awful experiences with particularly senior male professors who, put in all the effort into Helen Joseph, and on the day I was leaving, I get the head of it is like, oh, well, I'm like, geez, 30 years I've created change in your university, and you've just like literally like, well, off you go. And then you think to yourself, well, that's not nice. And then you think, okay, but it's on him, not on you.
Exactly.
And that's what you've got to do. You've got to look at how other people behave, okay, and say, it's on them, not on you.
And I think that
move
mindset
forward.
changes everything, Professor.
Absolutely, because if you're like, oh, that's so bad, and why have I been done wrong and done this, then I think that it's A, not good for your soul, it's not good for any aspect, but it also doesn't teach you. So you need to look and say, that wasn't nice, okay, but how are we going to move on for it?
Yes.
Really important.
I think that is always looking at the positives.
Absolutely, and you've got to do that with any relationship, you know, marriage, children. When I work and speak to patients, and I've got to say, they're vulnerable. Let me hear them, okay, first, and that's important.
So, Professor, you mentioned fairly early into the segment that you came from a family of teachers.
Yes.
And obviously everyone thought, okay, Carol is going to now be a journalist.
Yeah.
But Carol went on to explore something totally different.
Yeah.
How did that calling come about?
So I think I looked at a family with a mom who did so much work in poverty relief and making changes in this country. And I thought, how can I help? How can I do things to help out? And really for me, healthcare was the calling of service for me.
Right.
And that's how I started in it. And I think what people also need to realize is you must be able to adapt and change. So I went into medicine thinking I'll do trauma and make changes in terms of, I was very, very involved in the 90s, going into really, really, really scary areas and being involved with people who had quite significant gunshots and injuries, etc.
Oh, wow.
And so I thought that was the route I was going to go.
Right.
And then you have things happen in your life, like seeing all these women treated badly, and then I moved in this direction. So you have to have flexibility of being able to change. So I do loads of international teaching, loads of outreach work, operating patients, etc. But I always say to the youngsters, I could turn around in the next 2 years, I'm not interested in not doing it, and say, actually, I have a focus and a need to go and help out in this environment.
Right.
And we must be able to do that. I think that's
and I love what you're saying, be permeable, be adaptable to any kind of surrounding.
Absolutely.
Okay, so Professor, you wear many hats. So we have touched on your vast qualifications in the breast cancer, sector.
Yeah.
But then you've gone on to, do some writing and research.
Publication,
Can we touch more on that, please?
So I'm anxious by nature. I'm a busy person. I always say, like I said, you've got to know your faults and your findings.
Right.
So I like to be busy. So I work really hard. Writing is an outlet for me. So I've written lots of textbooks. I've just almost finished another one now in the last 2 weeks. And then academic writing is important. Real world research and being involved in how cancers happen and how they start, and I'm busy with another PhD on that. And you've always got to, I always say, show me the data and document it and write it down. It's such a problem for Africa. We look and we go, oh, this is the US and this is this, and they're publishing that. And we have so much here, and we just need discipline and teamwork. We have real world experience of seeing and being exposed to unbelievable things, and we need to be able to tell a story, okay? And what I'm always surprised at is we've had some African first. There is magnetic seeds that we did the pioneering research here, and now they're used throughout the world. There's certain reconstructive techniques that we've done the most of in the world and worked out things. We're doing a lot of work in digital and AI and how to bring healthcare and safe breast-saving surgery to women all over Africa. I'm involved at the moment in an Africa Breast Cancer Council that I am the chair of, and it's about bringing Africa together. Africa's great. We need to expose what we do well,
But that's
stop
the thing.
being embarrassed by, yes, there's a lot wrong, but there's a lot wrong throughout the world. And what we need to do is show gratitude and an ability to change and work for people.
And I just love what you're saying, highlighting the positives that Africa has been a
Absolutely.
first in.
Absolutely.
And it's not something, Professor, that we hear of all the time.
No.
So kudos to you, for highlighting that
Yeah.
aspect of how far that we have reached in medical science as well. The progress that we have made thus far.
100%.
That is absolutely inspirational because we don't know of it.
Yeah.
We don't hear of it.
Yeah.
But now that you're highlighting it, that's absolutely inspirational.
And I think for me, so that's why I always say, show me the data and publish it. But what I want to do, and we've got a big meeting coming up in Egypt, is we need to point out what Africa does well. And we should, as a group, say, hold on a minute, look, in Egypt, they have these clinics that work out. Here we have access to virtual and teaching and different awareness platforms, and what are they doing in Zambia, and in Kenya they have that, and so we need to show and learn from one another and stop looking at going, well, they're doing this in New York and they're doing this, and we can bring up our best and help balance out what we don't do well if we are prepared to have an attitude of learning, and an attitude of service.
And I think that's where you make such a big difference, Professor, because you've highlighted that aspect that you are so open to learning new things all the time.
100%.
And I think that can only come from a place of growth and success.
100%.
Okay, so Professor, moving on to a very important topic, and one that you are extremely passionate about, that is breast disease.
Yeah.
Now, I would believe that aside from the hereditary factors, there are a lot of other contributing facets. Please can we highlight on that first, beginning with how did you get so interested in the various aspects of breast disease, and to the founding of your Breast Health Foundation as well?
So I think what we need to remember is that 65% of people who get breast cancer have no risk factors whatsoever.
Wow.
Wow,
Okay.
yeah. When I say that, everyone's like, right? Breast cancer is neither ageist, racist, or sexist. Happens to men, happens to women, happens to young girls, happens to elderly people. About 25% of people have family history on their father and mother side, and only about 8 to 12% genetics. So there are changes going in cells all the time, and we need to work out how it affects between the environment around the cell and the little repair genes in the cell. But what was important for me and how I got into this and set up foundations is people know. You know, if you've got a headache, a pimple on your nose, a lump in your breast, the problem particularly in our type environments is our hospital environments are hostile. So you're aware if you've got a problem. My worst word is ignorant. No one's ignorant.
Right.
You might have ignored something because you didn't know how to access a system.
Right.
Or you might have ignored it because you were scared that you heard that somebody said you need to take both your breasts off, which you don't. We almost don't need to do any mastectomies today. Or you were frightened of the concept of chemotherapy, where actually we often don't need to use it today. So maybe ignored, but we're not ignorant. We're scared because the environments are hostile. Can you imagine? And this concept of setting up these regimented clinic structures is totally wrong. Here you are. You have very little money. You catch 2 taxis. You come all the way across to a clinic, and someone tells you, there's no clinic today. Or, oh, and you pay your $70 and you have your transport. Sometimes people spend more money on transport than they do on the entrance to the hospital. And you go back and forth, and now you have to go to another hospital for a different thing, and you wonder why people are overwhelmed. So they think, well, what do I do? So when I set up clinics, and I've got peripheral clinics in very small outreach areas, people walk far. We have nurse-based clinics. We try and set things up so that there's an easier flow. Because when someone's sitting with a big lump in their breast, they know it's there. It's just how hard it is to access it. Or 3 or 4 ladies yesterday who weren't on medical aid, didn't have funding, need a biopsy. So to have even be on a low-end medical scheme and not being able to afford a biopsy, and then the biopsy costs 12,000 Rand, and then somebody says, well, we're going to cut it out, which is wrong. I mean, I did a Teams meeting last night with a lady, not from Joburg, who the surgeon wanted to cut something out, and I'm like, no, we can manage this, let's review it, come to Joburg, and we'll, and you definitely don't need an operation, and maybe you do need a small needle biopsy. So we need to empower people. Question your doctors. Don't rush into operations. Understand the diagnosis. Understand your options. And don't, when somebody says you have to see this doctor or you have to see that doctor, you don't need to. You have a right to say, no, I want to go here. I want to see, hey, I don't like that old blonde person because I don't like waiting in a room. And then you go and see whoever you want to see. You
have the choice.
You have the choice. And cancer is not Little Shop of Horrors. It's not running around your body in 24 hours. I'm so fascinated when I see ladies and they say, the surgeon said to me, I need to make a decision today, and they're booking me for take both breasts off on Thursday. Absolutely not. You never make decisions in doctors' rooms. You take someone with you to the consultations. You have a right to record out the consultations. You have an option for second opinions, and you never just rush in because someone said.
Professor, but from your vast experience,
Yeah.
do you think it's the misconception that people have been fed over the years that they feel, okay, fine, I've now been diagnosed.
Yeah.
I don't have that many options to explore.
So I might as well.
Yes,
Yeah.
should the surgeon
Absolutely.
say, I've got to go in for a mastectomy, I'm going in for that mastectomy. I'm not going to now explore other avenues because...
So that is the wrong thing to do.
Yes.
Because often taking the breast off is the wrong thing to do. Often starting with surgery is the wrong thing to do. You mentioned at the beginning professorship in immunology. So the concept is that we're getting better at working out how to switch cells off. There's going to come a time in a couple of years' time where there's a lot of breast cancers that we're not even going to need to operate on.
Okay.
And it doesn't mean everyone needs chemo or this or that. What we need to understand is that we want to know what type of cancer it is, what all the options are, that you do have options.
Absolutely.
Okay? And not be pressurized into trigger responses or this concept of, well, what must I do? Just go with the flow. It's often a mistake to do that. You must question. You must understand the whys. And it's not good enough for someone to say, oh, we're going to discuss you in a meeting. Because you want to know what is your data outcomes, how many people were in the meeting, what was the review, what were the other options. Not the case of 5 of us all agreeing to do the same thing.
Absolutely, Professor.
So,
You're 100% correct.
yeah.
Now, as we are in Breast Cancer Month,
Yeah.
I just want to highlight, the misconception surrounding mammograms.
Sure.
A lot of women tend to think they are so painful, number one.
Okay.
Number two, the other misconception that is extremely common is that
Yeah.
should you then go for a mammogram, you are putting yourself up for cancer because it is radiation.
Okay.
I just like you to elaborate,
100%.
and eliminate, because you are
100%.
an expert in your field.
100%.
To eliminate some of those misconceptions that, some of our viewers may have.
Yeah.
And should they want to, explore that avenue of a mammogram and want to do that mammography, what is some of the things that they need to really alleviate?
So I think the first thing we need to do is tell people how to check their breasts. So the first thing you do is when you stand in front of the mirror and you take your top off, you must do the maneuver where you lift your arms all the way around to the top of the head and you're looking that nothing's pulling the nipple in or pulling any of the tissue in. Okay, you feel your breast softly with your 3 fingers. You're feeling right to left breast and left to right breast, and you check your nipple that there's no change on the nipple. If there's change on the areola, the brown area, it can be eczema, but you want to watch change on the nipple, denting in the tissue, and you're feeling for masses. There's no such thing if you've got something, oh, well, it could be hormonal and weight, okay? You need something as simple as an ultrasound, okay? Particularly if you're young and under 35, You can have an ultrasound if you're over 35, and then we can add in mammograms. When you check glands, you relax with your hands gently on the side to feel it. If you lift your arms up, you cannot feel the lymph nodes. So mammograms, okay, they are painful if they're not done properly, even if you've got very small breasts.
Okay.
So breast cancer doesn't discriminate. Left, right breast, small
Like
breast,
you've
big
said,
breast, etc. So when you do the mammogram, you lift the breast up and then you squash it down, okay? And then from side to side. If you're trying to push it down, the base of the breast is actually fixed, and that's where you have discomfort.
Wow.
So the next thing is make sure you go to a unit, okay, where the doctor is doing the ultrasound and they're checking things and doing things properly. So they recognize breast radiology units.
Okay.
And the next thing you need to know is there's more radiation in Santon City or on an aeroplane than there is going for a mammogram. So go for your mammograms, guys.
Thank you so much, Professor.
Absolute
It has
pleasure.
been an absolute inspiring evening in your company. I want to thank you so much for joining me.
Thank you. Pleasure. Need me for anything, you let me know. Okay.
So that brings us to the end of Visionary Pulse, another wonderful segment with a visionary game changer and change maker. Please join me again next week as I chat to another wonderful visionary game changer and change maker. This is me, Farzana Mayet. Assalamu alaikum.